Welcome to a podcast brought to you by the American Academy of Orthopedic Manual Physical Therapists. Our academy is a national organization committed to excellence in orthopedic manual physical therapy practice, education, and research, and we're here to explore a wide range of topics with you through interviews with content experts.
Hello, my name is Stephen Schaefer. This week, I'm pleased to bring to you our first ever podcast extra. As you may or may not have noticed, our regular episodes are released every other Thursday. However, this is an off week for the podcast, hence this is podcast extra. The conversation you are about to hear was recorded as part of the AAOMPT Ask the Expert webcast series, which we will link to in the show notes. During these interviews, experts in orthopedic manual therapy are interviewed about a wide array of topics. In this particular installment, Chaconas and Lindsey Hughey speak to Dr. Elaine Lonnemann, who just so happens to be the current president of our academy. As you've no doubt noticed, thus far the podcast episodes have focused on both research and clinical practice. However, the Ask the Expert webcasts are more informal and therefore allow for the conversation to unfold in a variety of different ways. While this format will certainly be new to our audience, it allows both for the interviewers and interviewees to explore the subfield of manual therapy more broadly. It is our hope that you find these conversations to be both entertaining and informative, but we also want you to remain excited for our regularly scheduled episodes, which will continue to disseminate every other week. All right, let's leave my introduction to the conversation there and turn it over to both Lindsey and Eric.
Welcome everybody to the AAOMPT Ask the Expert webcast. My name is Eric Chaconas. I am one of the co-hosts along with Lindsey Hughey. Lindsey and I are both AAOMPT fellows. We serve on the PR committee, and we wanted to do these interviews to bring you influencers and leaders in the world of physical therapy that are affiliated with AAOMPT. So specifically dive into the topics that are pertinent to AAOMPT membership and AAOMPT fellows, and those that are interested in manual therapy and AAOMPT in general. We've had Chad Cook, Bob Rowe, Tim Flynn, Rob Tillman on in the past. Today we get to bring you Elaine Lonnemann. Elaine is the current president of AAOMPT. She is the transitional DPT program director for the University of St. Augustine and interim associate dean for the College of Health Sciences. She is the first AAOMPT female president. And we get into a variety of topics related to cultural diversity, both in AAOMPT and in the physical therapy profession. We talk about Elaine's journey as a female leader, and she just has a lot of advice for aspiring leaders, and just a powerful, I think, speech on that topic. We also get into COVID-19 and how COVID-19 may be impacting the world of manual therapy, and a new publication that has coming out next month that Elaine co-authored in JMMT. So without further ado, here's Elaine Lonnemann. The first topic we're going to get into is kind of what AAOMPT is and how it plays a role in the greater physical therapy profession.
So AAOMPT is a national organization. It represents close to 4,000 physical therapists whose special interest is really in orthopedic manual physical therapy. Our membership includes individuals who are the leading researchers, academicians, clinicians who really specialize in spinal and musculoskeletal care with an emphasis on manual therapy. So, in essence, AAOMPT is a home or a community for people who have that special interest in OMPT. So, if we look at manual therapists, who are our members, because I think, okay, this is the association, but our members really are, as I said, leaders in research, but they are more than hands-on skills. I mean, people tend to look at manual physical therapists as, oh, well, they just manipulate or mobilize or, do soft tissue mobilization, but really they specialize in advanced clinical reasoning, and that helps us to determine the most effective patient management approach. And that approach then integrates our hands-on skilled manual techniques. It includes specialized or targeted exercises, and especially education, so that we really do optimize the outcomes for patients who are in pain, so that we can reduce pain and we can improve their function. So that's, in a nutshell, what AAOMPT is and who our members are, and I can speak to the mission and vision a little bit, because I think it ties into who we collaborate with, so our proposed mission is excellence in orthopedic manual physical therapy. And that's just a new mission that the board has been, the Strategic Planning Committee has proposed. And so we're still working to finalize that. But really excellence in the specialty of OMPT as a mission. And then our vision, how we see ourselves, is we really want to be leaders transforming healthcare. And we'll stay in the lane of orthopedic manual physical therapy, but it also involves all the other things that are a part of us, our clinical reasoning, targeted exercises, and patient education. So it's that package, if you will. And I think that has been what has really linked us to APTA and offered the opportunity a long time ago when AAOMPT developed to start collaborating with APTA. And so we do collaborate very closely with them, with the APTA federal and the state government affairs forums. We're involved with APTA's Practice Affairs Forum, which at one point was also called the, if I can remember, the Manipulation Task Force for APTA. Other groups that we collaborate with are the Academy of Orthopedics and the Foundation for Physical Therapy Research. So we work closely with all of those groups. We've been involved with accreditation and really started manual therapy accreditation or in residency accreditation, and brought that to APTA before ABTRI even existed, and collaborated because it really, both of us are working to improve the profession. We are a small group. I mean, our members are 4,000. If you look at the orthopedic section, they're probably close to 19,000. And Orthopedic Academy of Orthopedics, I apologize, is now, is probably about 19,000 members. And orthopedics encompasses many, many things, including manual therapy. But we have a specialized niche and in a specialty area that really it is our home and our focus. And I really loved how Rob Tillman said, it wasn't about we had to develop, that I think that's another thing people have asked me, well, why does AAOMPT even exist? You've been an APTA member since you were in PT school. And I was the student leader of the APTA group. And I've maintained I've always maintained membership, but AAOMPT has collaborated very closely with them. But we developed because, just like Rob said, we have a special group of people, and maybe special isn't the right word, a group of people who are focused on an area of interest that isn't completely the focus of APTA, understandably. And and also our focus was on excellence in education in OMPT, which was a little bit different at that time because we were required to do oral and oral practicals, as well as practicals where we could look at, the residents or the fellow in training hands-on techniques and their care with the patients and how they delivered things, in a face-to-face situation. And at that time, it wasn't an opportunity, it still isn't an opportunity, other than residency and fellowship training. It wasn't an opportunity that the APTA was able to afford. So we were able to dive right in. And again, as a partner, in a collaborative relationship with that group. So, APTA knows they can come to us at any time. We've worked together on lots of different task forces, and we continue to do so. Sharon Dunn and the rest of the board are an amazing group of individuals. I had a recent opportunity to attend the House of Delegates as the AAOMPT president. I'm a guest in the House of Delegates, but this year I was actually able to attend as one of the Kentucky delegates. So we're another different hat. But it was a great experience, and again, just wonderful people and leaders in the House of Delegates, and so much respect for the APTA board, and appreciate the opportunity, to work with them. So I guess that's our relationship, and hopefully that explains it.
Yeah, thank you for sharing that and kind of sharing the mission and vision of AAOMPT. and how that excellence, really runs deep. And I think mentorship is kind of that key that we give, that mentorship and accountability, like you mentioned in residency and fellowship, where the videos are being watched and we're held accountable to be experts in our field and make good decisions. And I want to ask you in particular how you got to where you are as our first female president of AAOMPT. It's been there for over 25 years. Can you tell us your journey of excellence to getting there and playing this role?
Yeah. So, I get a lot of questions. Well, you're the first female president and, it's been 27 years. Why wasn't there another one before you? Or, how did you get there? What was your journey? And, it was good timing for me. I have always, one of my life's missions has been to be a leader, and a leader in all paths, because I view leaders as very authentic, honest, positive people. And so for my family, for my husband, for my, job in teaching, for my clinical practice, I really wanted to, be a leader so that I could really shape the future. And if that's shaping the future for just my family, that's fine too. But it's always been part of who I am. So whether, in any of those areas, and I was invited, I guess, through mentorship originally, to lead. I was sought out to teach, and that whenever my mentor, who was Stanley Paris at the time, said, I see you as a leader, I went, I had kind of done some things before then. I was obviously already a physical therapist. I'd been the student leader of the APTA, and he gave me recommendations. So I guess part of my path was, he gave me feedback. A lot of people gave me feedback, and I listened to it, so I think people need, especially females, especially underrepresented individuals, really need to welcome your champions. And listen to them. Know that criticism is going to come with a contract. If you're going to lead, if you're the leader of your family, criticism is going to come with the contract. How you deal with that and how you change yourself is, I guess then the next step. So I guess it came through mentorship, through my residency fellowship. Had an opportunity. I was the second resident of the University of St. Augustine's residency back in '93, and Ken Olson was the first resident. So you might recognize that name as the past president of AAOMPT and the current president of the International Federation of Manipulative Physical Therapists. So I had a great opportunity to learn with people who were motivated and really wanted the same thing for their patients. And that was exciting for me. So I started getting involved at levels that worked for me. And I think for women, I think that we have a different pathway to leadership than individuals of other genders. So I think you just, as a person, you have to take all of it into consideration. And so I kind of lightly tread into, the invitations that people gave me. And then one day Tim Flynn called me and said, would you be interested in serving as secretary for the year that was open? And I'm like, oh, and I said, yes. It was one of those things, again, if you're invited, you not only have to listen, but you have to agree to do it and try it and be willing to take those risks. So that was the path to 2 terms as elected as secretary of AAOMPT. And I just learned a ton. And even though, the boards comprised, different genders and all of the presidents were men, I never felt unsupported as a female by any of the individuals on the board, regardless of gender. We were really all there, not as a, power position, but really to lift each other up. And that's really why I stayed in this, because it was an incredible experience. I feel like I learned a lot. I was mentored. People weren't afraid to give me feedback and welcomed mine. So it wasn't, a one-way street. So I guess that, someone asked me, well, why did you then go ahead, decide to run for president? And I think it was because, again, I felt like it was the right time, and I would really like to shape our future. I'd learned a lot as secretary. I had started some initiatives and organization of our governance, and I became more interested in that. Bob Rowe mentored me in that pathway, and I I really enjoyed it and thought, you know what, I really do want to shape our future and not have to react to it if possible. I have a great team, so I say I'm shaping the future. It's not, I can't take that all on myself, but and that's the other part of it. Great people, great team, and just an incredible opportunity. It's really been my privilege to serve.
That's great to hear. And like, we rise by lifting others up, and it sounds like that's your mission here. And to speak to that a little further, could you speak to the current climate of right now, where we're really addressing inequality, not only in the United States, in our world, really recognizing that it's present? Where do you see AAOMPT going in this topic and making a change?
Yeah, and boy, that is a tough one. Right now, there's, I sent out a message recently that, I firmly believe that AAOMPT members are completely opposed to racial discrimination in any form. And, we have to speak, we have to act on those beliefs, and we have to be examples for not only the profession, but for our patients, and support those individuals. So I think part of what I can do, and I kind of laughed because Rob Tillman said, I'm not going to tell an organization what to do. And he doesn't. He's wonderful. But I will say that when he came to get his certificate on stage, he shook my hand and said, Elaine, diversity, inclusion, and equality needs to be in the mission statement if you're going to make it important. And like, that was unusual. Usually it's congratulations, nice to meet you, have fun. So, but he's so passionate about that topic. And, so was the past president, Jim Rivard. And so are the members of the board. So we developed I felt like it was time, and it wasn't just because of that comment. We had been discussing that even as a secretary, when I was on the board as a secretary, but it was time to develop a task force on diversity and equality and inclusion. So that's what we've done. We've started that. Jim Rivard and Loretta West are the co-chairs. They're AAOMPT members who are very passionate about that topic, and they have a great team. Gail Dial, who is the secretary of AAOMPT, has had great experience in the military with diversity and being on diversity panels. So I learn a lot about our board members, and we have an incredibly experienced board and very passionate. Megan Donaldson already had initiated some diversity policies and procedures in the conference manual. So we're working on it. We are open, and I think the other part that we have to do is we have to listen. We have to listen to other groups, the American Academy of Physical Therapy, and the individuals we treat, and be open to what we need to do to have good actions and to move forward to really try to reduce the situation that we're in currently.
Yeah, thank you, Elaine. It's powerful. I think the interview with Rob was really eye-opening in a lot of ways. And I think if for those of you that haven't already seen that, please go back and watch a couple episodes ago, or it might have been the last episode. Rob Tillman, just such a wonderful, wonderful person. He's the president of the American Academy of Physical Therapy. And it'd be neat to see that organization kind of, join forces with AAOMPT to tackle this issue.
Well, Loretta West is a member of that group, and she's our co-chair. So I fully am certain that we will partner in this collaborative process. Great idea.
Yeah, that's awesome. So I think changing gears a little bit, the other big topic I think that people want to talk about is that most people think that manual therapy has an identity issue, AAOMPT has an identity issue. When you think of the fact that manual therapy is in the title of AAOMPT, and that probably doesn't really comprehensively describe what we do. It's really so much more than that. So are you all looking at any type of rebranding? Is that something you're thinking about, like a name change, or just to change the overall brand of the organization?
Well, I agree with you. We do have a bit of an identity crisis, and so does the board. One of the things that we are doing is we need to describe who we are. We really need to tell our stories, because we have some fantastic stories. We need to get those stories out there. We've started with some press releases. We did last year we did a press release talking about degenerative disc disease and, getting our name out there and who we are and what we can do to help prevent some of the current situation. We're not the panacea, and we didn't say that, but we can help, and we want to get our name out there because we do feel like we have a significant role as primary practitioners when it comes to various musculoskeletal problems. So we another task force that we just recently developed is a task force to describe the OMPT practice, orthopedic manual physical therapy, to get a description. Now, AAOMPT has a description, but we feel like we also want to make sure that it fits. We may land on the same description, but we want to make sure that we have a description that we can brand to the public, not just to the public, to the profession, to our peers, to our colleagues, and really with an approach that we can collaborate with other groups, that people know who we are and can come to us to promote our ability to practice effectively and with evidence-based care. So that task force is being led by Jason Silvernail, and have several of the board liaisons and a great group of individuals, Julie Fritz, Chad Cook, several other individuals not coming to mind at the moment, but it's going to be a really good group. Oh, Eric, of course. So I'm going through my list in my mind. Eric has agreed to be on that. Paul Mintkin has also agreed to be on that, and Stanley Paris is a consultant. And so I think it's going to be a really good group of individuals who have a strong passion and belief that it's important for us to describe who we are. Now, the other part of that question was, do I feel like, are we planning to change our name? And there have been some countries whose manual therapy groups have changed their name to more of a musculoskeletal group. And there's some discussion in the US, we don't just do manipulation. Well, no, we don't, but let's brand ourselves better. I personally, and I'm just going to speak for me, not the board. All right. I personally think it would be a problem. It would be a bad decision to change our name away from the manual or manipulative component. And the reason being, because when we started, this was our home. This is our specialty. We're 4,000 out of, we're not part of a 19,000 group, and they're the musculoskeletal specialists. So at least in the US, I think it would be a mistake because we already have the Academy of Orthopedics, and we have such a great collaborative relationship with them. Let's keep who we are, and and keep separate from APTA. Remain partners, but let's be agile and have the ability to be nimble and move forward to make decisions. And I know other countries have made decisions to change their name, and I am not going to judge those decisions. I don't know if they have a musculoskeletal or orthopedic group. They may not have one. So maybe that was their rationale for it. But I think the brand of manual and manipulative therapy is very important because it implies hands-on, not all the time, but it implies some hands-on. I think it also implies a connection. And right now in this pandemic, that connection, of course you can have your therapeutic alliance, but that hands-on connection, the caring and skillful touch of an educated individual, I think is incredibly important. I think it would be a problem, and it would be not a good decision to move away from that aspect of branding.
That's awesome. You are such a good spokesperson for us, Elaine. I mean, you really, I have not heard that framed that way, and you're so eloquent in the way that you describe it. The last thing I want to ask you about, another kind of thing I'm really excited about, that I'm aware that you have an invited response to the editor in JMMT coming out in the next issue COVID-19, wash your hands, but don't erase them from our profession. Considerations on manual therapy, past and present. That is, talk a little bit about that if you can. And I know that's a response to another editorial that was written, but what's kind of your gist of that paper?
Yeah, so Gail Dial and I responded to the editorial. The editorial was by Cameron McDonald, and a great editorial by Peter Osmotherly, as well as Darren Rivette. And just a great editorial that talked about, are we potentially going to lose manual therapy based on, the current practice and the future, and is there cause to be concerned? And they presented it that, we have cause to be concerned about losing the manual therapy hands-on approach, or not necessarily losing that approach, but maybe it won't be prioritized in our healthcare systems across the world. So great topic to bring up. Our response was, yes, there is some concern, but maybe not as much as is presented. I think that we really need to, make sure that we keep our house in order. So really manual therapy stood the test of time, and their editorial really goes into the history. So it was very interesting to see that. But manual therapy isn't going to go away, and physical therapists are really the largest providers of manual therapy care in the world. So if there are negative observations about manual therapy, I think it might be related to the fact that we potentially have diluted our standards of instruction. And there's also the issue, our entry-level curriculum are so crowded. So it's difficult. As a program directors, they face challenges of, what content is important, what should we put in, but again, I think it's our role as in AAOMPT, just to make sure that as leaders that we really do promote that high standard of practice. We not only promote it, but require it. And that's one of the things that one of the things that has led to the development of our accreditation council on OMPT education through the Foundation of Orthopedic Manual Physical Therapy, which is a foundation of AAOMPT. And the board is removed from that, but the foundation has oversight, and the council is similar to ABTRI in terms of there are reviewers and it goes to a board, but we will require that the manual physical therapists that are fellows of AAOMPT will have met international standards, and we won't dilute the hours, we won't dilute the standards that are out there. So I digress a little bit from the editorial. I'm sorry. Just an area that's I'm very passionate about in terms of the standards, and I've kind of lived in the world of standards and with AAOMPT in the last few months in the development of this. So our editorial response basically, agreed, but also said, we are doing a lot, and telehealth isn't exactly the answer. There are some challenges with telehealth beyond the manual component. There's also, it's a little bit difficult to develop a therapeutic alliance. And there are some challenges to exercise prescription. So, nothing is a panacea, in and of itself. So I think that we need to be on the ground floor of the innovation. I think telehealth is a really good thing. And I think that, we need to be on the ground floor to make sure that we are involved. I think patients want connection. I think that therapeutic alliance is really solidified by hands-on care in many cases. So I feel like, I don't think we need, and they weren't catastrophizing, but I definitely don't think we need to catastrophize. I think we need to look at this position that we're in and really reevaluate as this pandemic has made all of us do, our role and how we can really do the best for the patients that we serve. So does that answer your question? The other part of that, sorry, something else.
No, go ahead.
The Cameron initiated a perspective paper where we sent out questionnaires to individuals, and it was a sample of convenience to clinicians across in different areas of the world, as well as manual therapy educators, just to get some ideas of what is going on, what are some of the screening protocols people are using, really to get some information out. And so in this, in the next, I believe it's May, June version. It's been March, May, June, for a long time. The days have seemed long. But in this recent version of JAAOMPT that will be published, and hopefully will be helpful to inform and the profession, and also instigate or start some more conversations about what do we need to do in terms of research.
Well, these are such challenging times in so many different areas. And you just, I mean, I'll say it again, as a leader, you've just handled it so well. And we're all in a better place, now. And I think because of all your hard work. So thank you, Elaine. On behalf of the entire organization, thank you so much for all that you do. It's really...
You're welcome. I've had a lot of opportunity, I will say. There have been some challenges that have come down the pike, but I view them as opportunities, and so has the board. So it hasn't been but just me, but thank you. I appreciate that.
Awesome.
Thank you for your time.
All righty. Well, we will see you next time, everybody. Thank you.
All right. Thanks. You guys have a good day.
Thank you.
This has been a production of the American Academy of Orthopedic Manual Physical Therapists. You can learn more about the Academy by visiting our website at AAOMPT.org. You can also find us on Facebook, Twitter, and Instagram by searching for our acronym, AAOMPT. The views and opinions expressed on the AAOMPT podcast are those of the interviewers and interviewees and do not represent the official position of AAOMPT. The information presented should not be used as personal healthcare or clinical practice advice. If you need to find an expert orthopedic physical therapist near you, then check out the Find a Fellow feature under the Public Resources tab at www.AAOMPT.org, which you can find in the show notes.